In this video, we will break down the most common and challenging Band 6 physiotherapy interview questions and provide expert tips and strategies to help you ace your interview and stand out as the strongest competitor. So get ready to level up your career by landing on your Band 6 job. My name is Ubaid and I'm a first contact physiotherapist working in NHS. On this channel, we help students achieve their career goals and help patients achieve their health goals. In our previous videos in this interview series, we have discussed in detail how to make an impressive job application and secure an interview invitation, as well as how to prepare for your interview day, along with the basic interview structure, the questions, the answers, and everything in between for a Band 5 role. The structure of the interview and most of the value-based questions remain the same. The main difference between MSK Band 5 versus Band 6 job role is in the depth of clinical questions being asked in an interview. At a Band 5 level, the interviewer basically wants to make sure that you ensure your personal as well as your patient safety at all times. You understand your scope of practice very well and consult your seniors as and when required. But Band 6 questions will demand an in-depth knowledge of MSK conditions, masquerades, and treatment options as well. A Band 6 is a senior level position for which you will need to demonstrate your autonomy and provide as much detail as possible regarding your clinical reasoning and judgment as well. A lot more time on average will be spent on each questions and there will be follow-up questions to pick your clinical brains. Sometimes there will be no right or wrong answer to the questions, but the interviewers are just interested in exploring your reasoning and the professional decision-making skills. Moreover, a Band 6 job role also involves taking on more management roles within your job. For example, mentoring juniors, leading student placements, etc. Therefore, in this interview, your management and leadership skills will also be tested. In this role, you will also be expected to consider the broader picture of things and the operation side of the services, for example, quality enhancements, key performance indicators, research projects, and audits, etc. Questions like your introduction, your interest in this role, your strengths, and your weaknesses have already been discussed in the previous videos in detail. Now, let's start with the example questions for Band 6 MSK role. As part of the introductory questions, you can be asked, why would you be a good candidate for this job role? To answer this, give a detailed description of your current job role, the qualities and the skill sets that you possess to perform your clinical duties, your participation in team building and CPDs, and how you are now ready to challenge yourself further and take the next step in your career. You have been exploring options and are very keen on this as your personal values are very much in line with the values of the trust, and you feel that this job role will definitely help you achieve your personal as well as professional career goals. As always, supplement your answers with real-life examples of delivering excellent patient care using tools like shared decision-making, biopsychosocial approach, and holistic care, etc. Moving on, in the non-clinical part of the interview, you can be asked questions about team management and conflict resolution skills. For example, you notice a member of your team repeatedly coming late, and this is affecting the waiting times of the patients in the clinic. How would you respond to such situation? Or give an example of a time when you had a conflict with the patient because you were unable to offer a scan that the patient was requesting. The patient was quite dissatisfied and wanted to file a formal complaint against you. How did you de-escalate and manage this particular situation? Or describe a time when the patient's attendants were dissatisfied with you. What steps did you take into consideration to ensure the patient's well-being and address the concerns of the attendants as well? Now, let's move on to the clinical components of the interview. Here, we will first discuss the example clinical questions and we will move on to discussing the important components of a good answer. Starting with the most important component, the red flags. Example questions can be either direct questions or scenario-based questions. For example, can you discuss a challenging case where you suspected a red flag condition and how you navigated the diagnosis and treatment process? What are the indications for immediate surgical intervention in patients with lumbar spinal disorders? A patient presented to you in clinic with acute on chronic low back pain and reported having bladder accidents since 2 days. What would be your subjective and objective assessment for this patient? explain with reasoning and differential diagnosis, and course of action. How do you differentiate between musculoskeletal pain and pain that may be indicative of a more serious underlying condition such as cancer or infection? How do you safety net patients about red flags? Moving on to neck and shoulder, you could be asked a scenario about assessing and differentially diagnosing a patient with clinical signs of cervical radiculopathy. How can you rule out a shoulder pathology with that of a cervical pathology? A patient presents with numbness, pain, and blueness in bilateral fingers. What would be your subjective and objective assessment for this patient? Explain with reasoning and give your differential diagnosis. What would be your concern for a patient with recurrent shoulder dislocation, and how would you manage it? Moving on to lumbar spine and leg conditions. What conditions or clinical features will lead you towards a referral for an urgent MRI scan? A patient presents with sudden onset low back pain that started after lifting a heavy weight at work 1 week ago. The pain is constantly there, affecting his sleep, and is radiating to his leg from back of thigh till toes. He's also experiencing intermittent pins and needles in the back of his right thigh. What would be your subjective and objective assessment for this patient? Explain with clinical reasoning and provide your differential diagnosis. How do you assess and differentiate between different types of lumbar spine conditions from visceral or more sinister pathologies? Can you discuss any tools used for screening of inflammatory back pain? Now let's discuss miscellaneous questions assessing your advanced knowledge and skills. How do you ensure that you are up to date with the latest research and treatment options? How do you manage patients who are concerned about potential red flags but do not meet the criteria for referral to a physician? How would you motivate and ensure consistency with exercise for a patient? Now let's move on to answering these clinical questions. The answers to these clinical questions should always include examples from the STAR technique, the Socrates method, and you should always approach these scenarios from a biopsychosocial point of view. Involve the patients in their care to reach informed decisions and make every contact count. To cover these aspects, you can always add statements to your answers like you always involve patients in shared decision making, you always support and educate your patients, you always take into consideration the patient's values and beliefs, and you always strive to provide excellent patient care whatever the situation is. If you cover these potential questions and formulate answers according to the guide we just discussed, you should be able to transfer these answers to most of the questions asked in an interview. And at the end of the interview, when asked, do you have any questions? Don't say no. Instead, you can ask things like, what does a day in this job role looks like? What training opportunities or internal CPDs are available for you? What options are there for career growth, etc. Showing this interest in the job leaves a good impression on the interviewer and enhances your chances of getting selected. I hope you found these tips and suggestions really helpful. Let us know if you have any queries or are struggling with any question in particular, and we will try our best to answer your queries in the comment section. Good luck with your professional journey. Until next time, bye.